Protests, rallies, television ads. It seems the healthcare debate has turned into a lot of people shouting their opinions like they're actually facts. So we wanted to do a reality check today and get some expert advice on how we should really fix our broken healthcare system. For that, let's bring in Kenneth Thorpe. He's a professor of health policy at Emory University. Dr. Thorpe, thanks very much for being with us this morning. We really appreciate it. So the Speaker of the House, Nancy Pelosi, and a couple of senators are saying that the public option for health insurance is essential to covering the uninsured in this country. Is it, or could it be done another way?
Well, I think, of course, it could be done another way. I think we need to go back to the basics of what we're trying to do here. One is that we have to find a way to control the growth in healthcare costs. And two, originally, we're trying to get everybody with health insurance. Those are the two major components of healthcare reform. We're now in a tactical discussion about how to achieve those ends. But I just hope we don't lose sight of what we're trying to do in the first place.
So let me ask you this question, because there are varying opinions on this. The Congressional Budget Office says one thing. A group that's owned by United Healthcare, the Lewin Group, did a study for the Heritage Foundation, conservative organization, that says quite another. Would a public plan drive private insurers out of business?
Well, remember, the public plan would only be offered to people who are working for small businesses or don't have health insurance. So the Congressional Budget Office has said that basically the cost of that plan would be about 10% less than private insurance plans and may enroll 15, 16 million people. So obviously most people would still be covered by private health insurance in this country.
So those 15 or 16 million people, would they be people who currently do not have insurance, or would they be people who are currently in private plans who choose the public option? And what's to stop employers, if the public option is cheaper, from dumping private insurance and going with the public option?
Well, employers that currently offer insurance today would not be eligible to dump their employees into the public option. I mean, the public option would be available to smaller businesses and people who don't have access to health insurance today. So what the CBO has said, the Congressional Budget Office, is that most Americans would continue to get coverage through private health insurance. And in fact, enrollment in private health insurance would actually increase. The public option would probably enroll maybe 15 or 16 million people. So that balance between the public sector and private sector would be relatively unchanged.
Now, you mentioned something of this, and I'd like to delve into more detail. This idea of cutting costs. A lot of this reform is aimed at cutting costs. The president has said we can't get our budget deficit under control until we control health care costs. What's the best way to do that? Because a couple of the ideas that are being talked about is dump fee-for-service, which is currently the way that health care is administered for the most part, in favor of what's called whole patient care. That is, you pay a sum of money to a doctor or to a hospital to treat the patient's current disease. Another model being looked at is a Cleveland Clinic, where doctors are paid salaries as opposed to fee-for-service. What do you think is the best way to cut costs in the healthcare system?
Well, that's exactly the discussion that we should be having. We got to go back to the basics. 3/4 of what we spend in this country in healthcare is linked to patients that have chronic healthcare conditions like diabetes, high blood pressure, abnormal cholesterol. And in the Medicare program, we have 20% of patients are readmitted to the hospital within 30 days. We need to rebuild the delivery system in this country to make sure that we're doing a better job of working with patients to keep them out of the hospital, keep them from being readmitted to the hospital in the first place. If we did some simple things in Medicare, just cutting readmission rates in half, we could save $100 billion over the next 10 years. That's the discussion we need to be having on how to control health care costs. I think we've become off-centered here by an exclusive focus on the public option. It's a good discussion, but we need to go back to the basics. Where do we spend our money? How do we really control health care costs? And it really starts with people that have chronic health care conditions.
And none of the plans that are currently before Congress deal with what doctors believe is a critical issue, and that is the cost of medical malpractice insurance. That tort reform is needed. I, for example, know a doctor who pays $80,000 a year in medical malpractice premiums.
Well, certainly for American physicians, it's a major problem. We've got to find ways to reduce the frequency of medical malpractice claims that are really unwarranted. You know, one of the things that's stunning to me is that 70% of what we spend on premiums, what physicians and hospitals spend on premiums and malpractice, goes to administering the system, adjudicating, arguing over who's right and wrong. We can do a better job in medical malpractice by reducing claims frequency and reducing the cost of administering medical malpractice. That'll save money.
And there's another buzzword out there. We've heard the president mention it several times. Best practices. There are some people, critics of these plans, who believe that best practices is a code word for healthcare rationing. Is it possible that, particularly under this public plan, we could see further healthcare rationing?
No, I don't believe so. Best practices is just basically meaning I want my physician to have the best information available in terms of evidence-based practice on what works and what doesn't work. If I'm looking at treatment options of how to manage my diabetes or high blood pressure, I want my physician to have the best clinical evidence of different ways of treating it so he can work with me on making a decision. So more information for physicians, more information for consumers, that's all good.
Professor Ken Thorpe of Emory University, it's great to talk to you this morning. Thanks for giving us your analysis on some of this. Very important.
Well, thanks for having me on.
All right, really appreciate it. Thanks. Karen?
All right.